Caribbean and African Targeted Health Improvement Programme, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Good morning, everyone, and welcome to today's Health Hour. My name is Dr. Vanessa Rapier, and I'm a consultant in sexual health and HIV and a health equity researcher, and it is my pleasure to be your host today. I am a regular host, but I haven't hosted for quite a while, so it's really, really great to be here. And one of the things that I love doing and hearing about is where you all are. So some of you are online with us, some people are on YouTube, some people are on Facebook, but within the chat, it would be great if you could let us know who you're watching with and where you're watching from, because from the very get-go, we have a very international session because I'm actually talking from Ghana and our speaker is abroad as well. And so it's great that we're going to have an international session just from the get-go. As I mentioned, we are on YouTube and Facebook, so we are streaming live. So the beauty of that is that after today, things that you've heard and you want to go back, you want to share the link with others to share the information, people can and will have access to the YouTube and Facebook link. So please do, even as you engage today, go back and engage again and share it to your friends, family and wider network. The Health Hour is designed for you and is designed with many organizations that have come together to think about the topics, but you also have influenced the topics as well. And the Health Hour is to educate you, is to empower you, and also, as I've said, to empower your networks as well. And so we also love hearing your feedback, and we also love hearing if there are any topics that you would like to hear more about and to get more information about. So we are here for you. And throughout every session, and today's no different, is that after we have our wonderful speaker go through her session, there's an opportunity for question and answer. And I personally love that session because it's an opportunity for you to engage, but also for us as speakers and hosts to learn what needs are out there in the community as well. So the best thing about this is engaging. So please think about your questions, put it in the chat. We'll be checking on YouTube and Facebook too. So don't feel shy, put your questions in the chat. And if you feel comfortable to ask online, whether you want your camera on or off, that's fine, so long as you unmute yourself so that we can just have a great session together. So it is my complete joy to introduce my colleague, I have to say, in the sexual health space, Dr. Dornu Lebari. And I've known Dornu for a number of years, so it's great to kind of be working together on this session. And what I love about this session is that it's a session on sexual wellness. And I will leave Dornu to go into that into more detail, but the reason I love that is because it's moving us from a place of just thinking about, sexual health, infections, and really moving towards sex positivity and seeing the importance of sexual health in part of our wider health and well-being. So I'm excited that Dornu's here. And obviously it's a passion area of mine. So I'm going to hand over to Dr. Lebari to take us through her wonderful session. Lovely to have you here.
Thank you so much, Dr. Apea. It's nice to be here, and thank you, CAHN Network, for asking me to do this. I'm not going to lie, I'm just going to put it out there because sometimes I'm too honest and too shy, but obviously Dr. Apea is she knows because I've told her before that she's a massive inspiration and a hero of mine. So a little bit of imposter syndrome going on right now, but don't worry about that. I'll get over it.
Absolutely not, but that's very kind.
So, okay, what I was asked to cover, or rather what we are going to cover as well today is a few, see if this works. Oh, there we go. So we are hoping to cover aspects of body positivity and self-acceptance. I will go through a whistle-stop tour about safer sex practices. We'll also touch on sexual dysfunction, and within that, we'll talk about consent and communication. I don't apologize, it is a whistle-stop tour, because obviously, as you can imagine, we can't go into the ins and outs of absolutely every bit of this. But at least it's to try and get us having that conversation and talking about it. So, body positivity and self-acceptance is the first section I just want us to look at for now. And I guess in trying to understand or get to that point of actually understanding what we mean by that, because I think that term has been it's been around in the, ether for quite some time and can mean different things to different people. Generally speaking, though, body image, it's a combination of thoughts and feelings that you may have about your own body. And body image can either be positive or negative and can also be neutral. And one person may feel different about it at different times. You may feel positive or negative, and sometimes even a combination of both. Body image concerns refers to feelings of being unsatisfied with our bodies, either because of their appearance or the way they function. And this has also been described as body dissatisfaction. You may have heard it termed that. In contrast, a healthy body image refers to feelings of being satisfied with our bodies, holding respect, appreciation, and acceptance of their abilities, and having a healthy balance between valuing our bodies as well as other aspects of ourselves that basically make us us. So where does that image come from? Or where do body image concerns can come from? Well, body image, it doesn't just develop in isolation. We all have unique and personal methods for processing and coping with the different events and environments that we go through in life. And so those experiences affect the body image, our body image, and so will be intrinsically different for each and every one of us. That being said, though, research suggests that there are some key factors that can impact body image, such as relationship with our own bodies, relationships with our family and friends, how our family and peers feel and speak about bodies and appearance is a big one. Exposure to images of idealized bodies through media or social media, and a pressure to look a certain way.
Our desk is, just there.
Yeah, or to match an ideal body type.
And
I'm just going to share some of the figures from a lot of work done by the Mental Health Foundation in 2019. And some of these won't be surprising to you, particularly the stuff about social media, but I think social media does get a bit of stick about body image. But this is not a new problem since the advent of social media and has been around for some time. 1 in 5 of UK adults have felt shame because of their body image in the last year. Now, some of this data might be slightly, you could argue it's slightly outdated, but it is the foundation. It was the biggest research they did about this. 1 in 4 men have felt depressed because of concerns about their body image, and 1 in 10 women have self-harmed because of their body image. 4 in 10 teenagers have said that things that their friends have said have made them worry about their body image. So how we talk about this is very important. Almost half of 18 to 25-year-olds said images on social media had caused them to worry about their body image. And over a third of UK adults have felt anxious or depressed because of concerns about their body image. So how do we get to self-acceptance, and how do we link that back with body image? Well, I've put together my top 10, should I say, suggested tips to help us on this journey towards body positivity and self-acceptance. And the key thing I want us to remember is that it is a journey and that this doesn't occur overnight. And but it is also a journey that is ongoing always. So we'll start at the top and work around this lovely clock. So the first tip is to try to appreciate what our bodies can do. And this is something that everyone can practice. Most of us are lucky enough to have able bodies that get us where we need to go and allow us to do things that we enjoy. And that can be anything from walking, running, dancing, or even hugging your dog. Our bodies have done a lot for us over the years. So we should count our blessings and really celebrate everything your body can do for you. Second thing is to try to make a list of things you love about yourself. We're all guilty of focusing on our flaws or the negatives, even with ourselves and when we look in the mirror. And it's normal. It's normal to have body hang-ups. It's normal to not obviously be 100% happy with everything about your body, but giving all your energy to these physical imperfections is what magnifies them and can make you feel even more self-conscious. It also makes them the main thing that you see, or rather, sort of the center stage. To counteract that, make a list of all the things you like about your appearance, no matter how small, and keep it somewhere where you'll see it every day. Such as like your bedroom mirror, or the mirror you get dressed in front of, if that's what you do, or you can put it inside your daily planner if anyone still has one of those. It can even be on your phone, to be honest, and it can literally be even your your lock screen or whatever, somewhere where you'll see it every day. The third thing is super important, and it's really important to safeguard your own health, really, is to unfollow, block, and delete any social media accounts that make you feel bad about yourself. While social media can also be a great way to stay connected to people, it can actually sometimes leave you feeling less than. And there was an American study which revealed that 87% of women and 65% of men compare their bodies to images they see on social and actually traditional media as well. For the young people, that means newspaper and magazines. If you spend time comparing yourself to unrealistic beauty standards on social media, it might be time to just reconsider why you're accessing that content in the first place, and whether it's worth feeling down on yourself after scrolling. Number 4, seek out social media accounts that reinforce positive self-image. Like I said, while social media does get a lot of criticism for promoting an unhealthy body ideal, it can actually also positively impact body image. And you can curate your own social media to follow accounts that set out to empower you and inspire self-acceptance. Another research recently found that brief exposure to body positive Instagram posts actually resulted in improved body image and mood in young women when you compare it to idealized and appearance neutral posts. So actually seeking out body positive accounts may actually help boost your body confidence. Fifth one, challenge your negative thoughts and your own self-talk. Negative self-talk, obviously we know, can be very toxic and it does have long-lasting effects on us, but we can actually influence that and / control it. You may not be able to banish it overnight though. You can take steps to challenge and minimize the negative thoughts over time, such as recognizing when you are being hard on yourself. And one of the things I do for myself is I say, okay, when I'm being self-critical is I challenge it and say, okay, would I say that to somebody I care about? Is that how I would speak to them? And if I wouldn't say that to someone I care about, why would I say it to myself? Ask yourself if your thoughts are actually factual or if they're just based on interpretation and how you might be feeling in that moment. And, recognize and check yourself and just go, okay, right now I feel low about X and I feel, whatever. It's not to say you don't recognize your feelings, but just know, okay, I feel somewhat this way in this moment. Let me see how, let me recognize that maybe it's this moment and maybe the emotions are overwhelming. So I'm going to come back and check this negative thought in a different time, in a different place. Also, try to replace the bad with some good by shifting your focus to the things you like about yourself. The great chat you had with a friend recently, or the weekend plans that you're looking forward to. Number 6, wear clothes that make you feel good about yourself. This one takes a bit of bravery. Sometimes depends and I think the previous one about challenging negative self-talk will help. But for me, there are no outfits which should be off limits if you feel great in it. Your clothes should make you feel comfortable and confident, whatever your body shape. And just as there are endless body shapes, there are endless clothing items that are designed to either to enhance them or to, well, I don't want to say hide them, but yeah. And so find clothes that help you express yourself and make you feel good about how you look. Or in my case, glasses. Number 7, treat your body with some self-care. So do show your body some gratitude and treat yourself to either a pedicure or a new haircut. Now, I appreciate with the cost of living these days, this is going to get more harder. So we have to be a bit more innovative in how we do self-care. But a bit of pampering can go a long way for your confidence. And who doesn't love an excuse to indulge a little? And self-care activities such as massages and even just a bit of yoga, time to yourself, can help reduce stress and anxiety, as well as help you maintain good physical health and a body image. So it's a win-win. And number 8 is so important, especially for us in the UK. Accept compliments. I think I've skipped it on the thing, actually. I just realized it's not there, but it is probably the most important one, because I think, all right, do you ever meet compliments with like a grunt or rebuttal or just not even acknowledging it, or just, you try and say, oh, someone says something nice to you, like, oh, you look great today. You might be like, oh, no, this is old. And what do you mean? This is not even ironed today or whatever. Well, it's time to start accepting compliments. We know that accepting praise can be hard, though, for lots of reasons, apart from being British, because I think that's a trait. But anyway, research shows that while 88% of people associate recognition with a feeling of being valued, and so we all love it, really, but actually 70% of the same people also associate it with being embarrassed. Our knee-jerk reaction of refusing a compliment also refuses us the mental health benefits of receiving positive feedback, because that's what it is. It's positive feedback. It may feel unusual at first, but just try it. Just try saying thank you next time someone gives you a compliment. Don't try and counteract them. You might find it improves your relationship with yourself and the person who's offering you praise. Number 9, find a workout that you love. We've all heard the science behind how exercise can help make us happy, and moving every day can benefit your mood, your sleep, even your memory and learning. Not to mention, seeing the results of regular exercise can help boost your self-esteem as well. So find a workout you love, whether it's simply going for a walk or following a workout on YouTube, and feel the mental and physical post-exercise boost for yourself. Last tip, look at yourself as a whole person. It's important to see yourself as more than what you see in the mirror. Instead of solely judging yourself based on your physical attributes, look at yourself as a whole person with all the wonderful qualities that your friends and your family love you for. Okay, we're going to change tact now, and I'm going to talk about safer sex practices. So the term safe sex has often been misused to describe sexual behaviors, which actually still carry some risk. In my world, there is no such thing as safe sex, just as there is no such thing as a safe car. So I prefer the term safer sex to highlight that most of these strategies are about reducing risk. And when I say risk, most people often assume, that we're talking about risk of sexually transmitted infections. But I just want to remind you that that's not the only risk that comes with sexual encounters. And actually, if sexual encounters can involve way more risk than just, sexually transmitted infections or STIs. There's risks of exploitation, intimate partner violence, non-consensual sexual encounters, and lots of other things. So, as I said at the beginning, it is going to be a whistle-stop tour of ways to try to minimize risks associated with sexual activity. But just remember, nothing is risk-free, and it's about taking, I guess, it's a calculated risk, or just being aware of the risks and, accepting what risks you can and mitigating the ones you can as well. These are not, I'll also just put it out there that these are not the only ways to reduce risks. Okay, so here comes the whistle-stop tour. One of the most important aspects, so I'm going to mention this here because it is about reducing risk. One of the most important aspects of any relationship is communication, and that's all sorts of relationship, even if it is purely sexual relationship, a romantic relationship, or anything platonic, even our relationships with our family. All of it is based on communication. When you are clear about activities that you are comfortable or uncomfortable with, you can ensure that both you and your partners will have a better sexual experience. So don't be afraid to express what you do or do not enjoy with regards to sexual encounters, and do pay attention to verbal cues, body language throughout sexual activity to make sure that everyone's enjoying themselves. I couldn't talk about communication without talking about communication with ourselves. And this is important even for the young people. Before you begin to explore sex, it's really important that you explore yourself. It's really important that you get to know yourself, get to find out what things you might find pleasurable or might want to do with someone else. If your belief system allows for it, masturbation, with or without toys, can actually be a good way to figure this out, but it's not the only way. So setting aside some time to relax and explore yourself, not necessarily through masturbation, but just get to know yourself is so valuable when it comes to communicating your likes and dislikes with others. So learning to respect your own body is actually the first step in respecting someone else's body. And of course, I'm not going to talk about communication without talking about consent. All sexual activity must include consent. If you or your sexual partner express unease around sexual activity, put brakes on it immediately. Remember, a person who is intoxicated by alcohol and/or drugs is not really able to provide valid consent. And so no sexual activity should take place until either they're sober, and able to consent. So I hope you can all read this. So consent is active, it's clear, it's knowing, it's ongoing, it's voluntary, and it's required for all sexual interactions. So now, the bits about safer sex. Some of this may seem obvious, but I like to state the obvious because I always think it's better to just say it out loud than just assume people know. So forgive me if I am teaching you to suck eggs, but it's also good to have reminders, isn't it? So in terms of more practical safer sex tips, here we go. First one, keep fingernails short and clean. Very easy. And that's to avoid injuring yourself or your sexual partners. But don't cut them too close either, because if you get damaged nail tissue, it could be a point of entry for you to get, for the person, obviously, who's got the damaged nail, to get skin infections, possibly. Not just from sexual encounter, obviously. Second one, keep your toys and your body clean. So clean your sex toys between use with warm water and a gentle soap. You can put some of them in the dishwasher, but you'll have to find out if yours is dishwasherable. Avoid sharing sex toys if you can, and keep them separate. If you use enemas and douches, just be careful though, because they can sometimes cause small tears in the anal lining, which can make it easier to contract infections. Use a fresh condom, dental dam, or gloves if you use those two, for each new sexual activity. And this includes switching between vaginal and anal sex as well. It is preferable that you use a new condom. And obviously, if you're switching between sexual partners during the sexual experience, try to use lubes that don't contain oil, like silicone, because they can actually break down latex condoms. Water-based lubes are usually better. And obviously condoms, we've had them for centuries now, significantly lower your risk of either contracting sexually transmitted infections or passing them on. But just be aware that they can break or come off. So have a plan for what you're going to do in that situation. And as I said, make sure you're using a new condom and a new unused one every time you have sex. I've already touched on this, but use lubricants. This is especially important if we're talking about anal sex, but also for other forms of penetration, like vaginal sex, lubricant can be really useful. The more friction you get, the more risk of sort of tears in the genital tissue. And so again, that can theoretically increase the risk of infection or transmitting infections or acquiring infections. So lube, condoms, always a good idea. Establish a safe word. That means stop. Even if you have given consent beforehand, or even if there was consent beforehand, it's still important to continue that communication during the sexual activity. So establishing a safe word can help both you and your partner know when the boundaries may have been crossed, and then you know that that's it, sex needs to stop. Try to minimize drugs and alcohol. For obvious reasons, they can impair a person's sexual judgment, especially when it comes to being safe or consenting. And obviously, it can also impair or change people's, not just people's ability to consent, but what they consent to. So someone who's intoxicated or even under the influence of drugs and alcohol often may take certain risks that they wouldn't consciously agree to. So always gain verbal consent before and during sexual activity, and make sure that you and your partner are not too intoxicated to be aware of safety and respect for one another. This goes with, obviously, this is obvious. If you can, limit sexual partners. Remember that not everyone who offers you sexual contact deserves a sexual encounter from you. It is worth learning to be a bit picky. Really, really important, get tested. Get into the habit of having regular tests for STIs. I would recommend that you do this with each partner change, or at the start or end of any relationships. That's usually a good marker. Or if there are multiple sexual partners in the scene, then try to have a sexual health screen maybe at least every 3 to 6 months. Or obviously, if you have any symptoms which you think could be explained by an STI. I think I have mentioned this before in a previous talk, so I'm going to mention it again to those who weren't there. PrEP. Take HIV pre-exposure prophylaxis if it's applicable to you. And this is a really important one because it's highly effective in reducing your risk of acquiring HIV. Okay. I think this is the last bit. So we're going to talk a little bit about sexual dysfunction. And why have we put this in here? It's more just to get us talking about it, really. I'm not going to try to, through this talk, to solve everyone's sexual dysfunction, but it's just to make you aware that it is out there. It is more common than you think. And we'll talk about what you can do if you feel that some of this may apply to you. So sexual dysfunction is essentially anything that can prevent you from wanting or enjoying sexual activity. And they can arise from so many different angles. One of the things I did one of the things I was lucky to be part of when I was a baby doctor, should I call it, was looking at the sexual activity of people who had been diagnosed with different cancers, not just genital related cancers. And you'd be amazed of how much that can impact on people's sexual function, but also ergo, whilst it may not be the be all and end of someone's relationship, but it's a very important, physical contact can be a very important part of human relationship, and sexual contact is part of it, is a type of physical contact. Okay, so we know that it can arise from lots of different things, emotional factors, physical factors, and other things that, can be just seem like everyday things like drugs and pregnancy, even after pregnancy and menopause. Obviously that's mostly for women. So there are sort of 4 ways that we group male sexual disorders, and they can either fall under either of these categories of delayed ejaculation problems, erectile disorders, male hypoactive sexual desire disorders, and premature ejaculation. Female sexual disorders are usually classified under these 3: female orgasmic disorders, female sexual interest or arousal disorders, and then genital pelvic pain or penetration disorders. By and large, so these are some of the different factors that can be the basis for sexual dysfunction. This was actually taken from a different talk that we were looking at mostly men, but it is relevant because it also comes into play for some of these comes into play for females as well. By far, though, the most common reason currently worldwide would have to be lifestyle factors. So it is worth looking at our lifestyle about things like smoking, alcohol intake, our raised BMI, because whilst some of these disorders I've mentioned can we say they can either be primary or secondary, so i.e. it's always been there since someone has ever tried to have sex, or it's something that has happened later in life. We know that the lifestyle factors can have a massive effect. And obviously you probably can see that not only does the lifestyle factors have a direct effect on the sexual function, but also they can influence these disease factors that also contribute. Again, because of the complex nature of sexual dysfunction and the depth that the rabbit hole we could go down, I have kept it brief. So that is all I'm going to say. So you need to know that they do exist. They are well recognized. And if you felt that you were having a sexual dysfunction, it is really important that we start opening up, talking about these things, particularly with our healthcare provider, or maybe our primary healthcare provider. And there are lots of ways that these conditions can be managed, can be helped, can be treated, so that we can all have a more fulfilled sexual life and sexual health. So that's me for now.
Thank you so much, Donu. That's fantastic. And I think that we'll go into some of the questions that have already come through, but I think just the way that you've set the scene about loving yourself and what the importance of that and how it transcends everything, I think will first of all resonate with many people. But I think sometimes it's just really important to hear it and to remind yourself of that. So thank you so much. And I've got some questions that have already come through, so I just want to thank people. And some people have chosen to send me questions directly for privacy, and that is entirely fine, and please feel free to still do that. But we also have an opportunity to put questions in the main chat, and also for you to ask directly on the show as well. So many modes for you to get involved, some more private, some more open as well, and that's completely fine. So one of the questions that have just to kick off, Donu, was when you were talking about consent, someone sent to me as how do you support your teenage and older children to embrace this concept more? And then afterwards, the person added, even my sisters of my age in our 50s. So just wanted you to talk a bit more about sharing the concept of consent across all ages.
I mean, I guess maybe I oversimplify things because I've got a simple mind. So, but I think keeping it simple is key. So, so how do I share the concept? And I guess this is going to be the challenge because I'm going to have a prepubertal child soon. But it would be just reminding them that, it's okay to say no. It's okay to just say what you don't like. There isn't, because whilst I think, and I'm going back to a long time, so when I was a teenager, but whilst it can feel a lot of pressure outside, you would hope, hopefully, usually when it comes to the more intimate scene and when you are in that room with sexual partners, whatever, it's just you and them. And that is the point to say, actually, whatever you were boasting about outside, you're not into, that's fine. It's just like, actually, or it's also fine to just say, that's not what I want right now. It might be something you are into and something you may want to try, but if that's not the moment, it's okay to say, not right now. And that is no. Anything that isn't a clear yes or a clear absolutely yes is a no. So if someone's saying, I'm not sure, that's a no. Okay. But obviously, whilst it's better to say no, it's important for the teenagers to educate them to say anything that is less than a yes or an absolutely yes is a no. So, and that's fine. And if you've said no and things are still continuing in that vein, say no again. It's fine to keep saying no, to make it clear. And I think, and it's the same thing, whether you're a teenager or, in your 50s, saying no is fine. Or saying, actually, it might, and again, it could be something, okay, I was into that, but not now. There's lots of things that you might be into as a 20-year-old, and then you get to your 50s and you think, I'm tired of that. And I know we joke about it a lot, and sometimes we joke about it to the extreme where, where people go, oh, even I've had, friends who said, oh, sex, I'm not into that anymore. But what they actually mean is there is probably an element of like a sexual desire, disordered underneath that. So again, talk openly about what you mean to the right people. Don't just joke about it's fine if you want to joke about it, but don't just do that, especially if it is causing you distress. Go and see your doctor and talk about it, or go and see a counselor and talk about it, or just talk about it with somebody you trust and just actually, I really fancy my partner still, but I don't fancy them in that way, or I don't want to do X, Y, Z anymore. And also just communicate with your partner. Tell your sexual partner or partners and just say, actually, you may have known me for that, but actually I don't want to do X, Y, Z, or I just want to cuddle these days, or can we go back to where we have dates? Because that's another thing. A lot of us, when you've had longer term relationships, we forget how to connect to that person and how to love that person again. But actually, I always tell my friends, myself, my patients, go back to having dates. Get to know that person, because whilst you've had umpteen kids and been through lots of stuff, that's not the same 20-year-old you knew and dated. So get to know that person, who that person has become. Because we all change through our life experiences. So get to know that person again, go on dates, talk about not sexual things. And that's how you get to a comfortable place where actually consent needs to be clear. You actually are doing things that you like, but also your sexual partner hopefully is also involved and you're doing things that they like. And, it's supposed to be a shared experience, sexual contact. It's meant to be shared. It's not just one-sided. But I do say this, and I don't mind saying this, I know it sounds crude, but one person doing what they want in a sexual contact is not very different to rape without the other person's input. That's kind of what it is. So I know it's not that extreme for people who are consenting, but just make sure the consent is clear. And that's what you've got to teach your kids, and that's what we've got to teach ourselves. We're not too old to learn.
No, thank you. I think it's really powerful, and having spaces to have conversations like this, and even just to listen to how you're phrasing things and how you're positioning things, I think is so important. And I always I talk about intimacy and date nights, and I'm always very open about my life. I've known my husband now, but since I was pre-med school, and so it is so easy to get lost in the mundane of life, and making sure that there's enough Weetabix in the cupboard for the kids, and etc., and forgetting about each other and talking. And so simple, and date nights don't have to be expensive for listening on both sides, because you'll often talk to some people and they'll be like, it's not what we can afford in our life now, and I completely get that. But it's taking time to create alone time, whether it's going for a walk, whether it is sitting in the park, whether it's staggering times that you go before your kids somewhere. All those kind of things can just be really powerful for you to have time to connect. So thank you so much for that. And we're getting more questions coming thick and fast, which is great. So thank you. I like someone's comment. It's more a reflection that they wrote to me, and they've written in capitals: culture, culture, culture. That's the problem. We never were allowed to talk about sex. And I think I just wanted you to comment on that, Dornu, because I have my thoughts on that as well. And I'm sure that a lot, again, will resonate with many people on the call. So what's your perspectives and experience of this as well?
Well, that's why we're here, isn't it? It's to try and break that because yeah, definitely we don't talk about sex. You can probably see I cover my hair because I'm Muslim, so that's a double whammy, isn't it? Black and Muslim. Huh, you're never going to talk about sex. You just mutism about it. But I guess what I'm fortunate in the sense, I see that I'm fortunate. I feel I'm fortunate in the sense that I don't know. I think in my personal life, I just got to a point where I was just like, oh, no, we are talking about it. And I guess because it's kind of how I actually got into sexual health and decided I wanted to do sexual health, because I felt that it was such a taboo. But then I found out that there's all these other positive ways to talk about it. I think in my culture anyway, and in my family, it was framed as like this massive evil, that if you talked about it, that meant that we would all kind of rampantly go and have sex and the whole world would end. And it isn't that at all. That's the first thing. And the second thing is, well, they're all doing it. So why can't we talk about it? We're all doing it. So I'm not really sure what's so evil about it if we're all doing it and we're all still existing. So that's something I found funny. We're all doing it in one way or another, really. So why can't we talk about it? It's healthier to talk about it and talk about the good about it. Because, yeah, it doesn't always have to be evil. In fact, I feel the evil is in not talking about it, because and in my experience, I don't know if this is the same for you, Dr. Appiah, but in terms of working within sexual health and being on the clinical side, I feel and I found that it's in people's ignorance that they've taken the highest risk and actually put themselves at harm. So ignorance is in this regard is definitely never bliss. And so we do need to break down that barriers. And if we do want to look at, I feel like, the kids coming out now, I talk about sex openly with my kids, and, you can judge me for that whichever way you want. But my oldest kid is 8 years old, and he knows about his genitals and he knows the proper names for them. So, and we are already kind of having some of those conversations, obviously age appropriate and appropriate for my child. But, that's why it's so important that we talk about it, because all of us parents, nobody knows your child better than you. So you're going to know what's appropriate for them. Do you really want them to go and hear from whoever outside and their friends? That's more likely to cause them harm than hearing it from you. Plus, let's be clear. None of us think anything cool is what our parents talk about. So guess what? If you want to demystify and make sex less attractive, you need to talk about it as a parent, because then your kid's not going to be interested in it. Okay.
I love that. So many things to relate to there. Number one, coming to the seriousness of it, the ignorance, you are so right. It is the ignorance that places people to make decisions without being informed. And so, and feeling that they don't have a choice as well for many of these things. So completely agree. And if anything, if you don't feel confident talking about sex in any way, just know, and you feel that it isn't appropriate, just know that, see it as a form of protection. If that's going to make you feel more comfortable, see it as a form of protection, because it is part of an armory that is so powerful. But that conversation, what you're saying is so funny about, because I have a soon-to-be 8-year-old, just to acknowledge him, and a 9-year-old, and I went to the school recently, and she's in year 5, and they're doing personal health and social and education, and I said, oh, are you starting to talk about bodies? And they're like, oh, no, they will do next year, but the nurse will deal with that. And I was like, oh, okay. And then I said, one of the parents said, oh, I think you need to, talk to them directly, appropriately. I said, oh, you don't need to worry about me. I'm a talker and I talk about it all. And when I tried to speak to my daughter about it, she's the same. She said, oh, Mum, it's all right. It's fine. It's fine. I know it's called a vagina. I know. But actually, it's really beautiful to hear them use the right words, because it is empowering. So yeah. Love it. And I'm getting lots of private messages as well saying completely agree, and in the chat as well. And they're loving your double whammy pan as well. So the other thing is that when you started to mention about sex toys, which is always, and it aligns with, I think some of the biggest conversations that make people uncomfortable is about sex toys and masturbation. But a couple of people have asked a similar question, actually, in terms of how healthy is it to use sex toys, and particularly the impact on mental health. And someone's written, won't that lead to a form of sex addiction? And I think first of all, just to say, there is no right or wrong question. And I love the fact that everyone's just voicing some of their concerns and some of the misconceptions that people have heard about the use of sex toys. So just wondered if you could expand on that a bit.
Be scared of sex toys. They can't turn themselves on. I mean that in a pun as well. So they are there to, they can be a tool for self-exploration. And really, it's one of those things where if it's something you think you might want to try, it's worth trying, is my go-to. And again, it's worth, and the thing with sex toys is they're probably the safest form of sexual exploration you can do that I can think of. If it's just you and the sex toys, obviously, and because we know people can use sex toys together as well, together within a sexual experience, which is fine. But if it's about sexual exploration, sex toys can be a tool. They don't have to be the only way. That's the first thing. With regards to the masturbation, and I'm going to talk about masturbation without sex toys, because I sort of talk about sex toys as sex toys and having sex with sex toys, and masturbation slightly different. And masturbation, again, it doesn't have to be sort of, it doesn't have to be the way, you see it in American Pie, right? The movie. Oh God, I'm showing my age. Anyway, but the movie American Pie, if you don't know, Google it. And you see it in there, and it's kind of that kind of crude, and it doesn't, again, it doesn't have to be that. It can literally just be you trying to figure out where your pleasure centers are. It doesn't always have to be genitally based, by the way. Did you know that? People have different pleasure centers and have different places that go, oh, that was quite a nice feeling. Some people like it stroking on the inner arm, for example, and that can be quite sexually stimulating. I guess the masturbation thing, it has to be what you're comfortable with. Like I said when I was doing the presentation, and again, depends what your belief system is. If that's something you just go, no, I'm never going to do that, that's also fine. There's no right or wrong way to explore your body. There's no right or wrong way to find out your likes and dislikes. It's easy. It's also doable with somebody else, and you can just try things, particularly if you've got a trusting and you've already communicated with a sexual partner. You can try things with a partner. That can also be a way that you can explore your sexual likes and dislikes. Can masturbation lead to sex addiction? Not likely. I don't know that it ever has done. I don't know that I don't think anybody's done the research, but I don't think of all the people I've met with sex addiction in the past, I don't think masturbation was ever part of their repository. Most sex addiction or sexual addiction disorders usually involve sex with other people. That's the first thing. So, and it's a different part of the brain. And by the way, did you know it's a different part of the brain as well that you actually use in terms of self-exploration and sexual desire and sexual pleasure with other people and sexual pleasure just with yourself? It's a different part of the brain completely. So the two aren't usually interlinked. I think that's why, because it is a different part of the brain that you're stimulating. And really, this is about learning about yourself. This also fits in with the learning about your body, because your body is different. Your body, there is no other body like your body. And so, yeah, so you don't have to use sex toys is what I'm saying. Masturbation does not equal sex toys, and masturbation can be a safe way to explore your body. And I guess I should probably make it clear as well, in my brain, I'm talking to the women mostly here, but obviously the men as well, but I'm talking to you women, because a lot of us culturally as well, we're not allowed to have sexual desires as, Black females, are we? We're not allowed to have, but we're allowed to be sexually desired. We're just not allowed to have sexual desire. It's seen as kind of grotesque and a bit, and if you have sexual desire, it's assumed that you're a bit loose. I mean, I remember when I not first, but in the early days when I kind of became, started doing talks and stuff, and I got an email from a Muslim imam telling me that I'm talking freely about sex, so I must be a slut. So that was interesting. So there are all these concepts, and I think we have to fight against that because it's not true. Me talking about sex doesn't mean I sleep with 100 people. I don't. And I haven't had 100, and I haven't slept with 100 people. But what I do know, I know about myself, but I also know that other people need to talk about this and need to explore things for themselves, find out what their sexual pleasures are, and communicate that with sexual partners if they choose. And masturbation can be a good way to do that. It's not the only way. Sex toys can also be another way. Again, you don't have to do these things. These are just ways, alternative. I'm just giving you different avenues that you can take. That's all I'm doing.
No, again, thank you so much. And I think, and also thank you for sharing that negative experience, because I think it just highlights a lot of, the systems that we live in and the culture that we live in that can make assumptions about who we are just because we open our mouths and say sex or vagina or enjoyment, and seeing that all in one sentence. And but I think, again, more power to you for continuing to labor the cause and getting the message out there. So thank you. Now, another question is it that again, this is why I love this safe space and discussion, because the question is, why does it seem like Black men don't know how important it is to use condoms and practice safe sex?
Oh, you might have to ask black men. But okay, I'll give you my
Like that, like that.
perspective. I'll give you my perspective. I feel like there is, again, I think it's that cultural, yeah, it's the cultural kind of rhetoric, and it's the narrative that I think we have set for ourselves as Black people. And I think this, I'm talking to the men because I don't have the power to change this. The men have the power to change this. And I'm talking to the upcoming men, so to speak, the younger generation who are coming through. Remember what I said before, it doesn't matter what you boast about in the bigger spaces and like the theater, if you like, of life and with your friends and whoever, and that sort of, woohoo, I'm a man. Because I think it's kind of built into that kind of mm, Black masculinity mentality of, oh, I'm a man, I'm not using a condom. And you're just like, it's not manly. Sorry to tell you, it's not. It's actually, and again, it's building into that ignorance of just, I think that cultural expectation that, well, I've talked to my friends, I'm not using a condom. And I've spoken to many Black men where I said, well, why are you using a condom? Oh, it's going to get in the way or it's going to impact on my performance. Okay, have you ever used a condom and it's done that? And the answer is no. So you can't say something that it's going to impact my performance, but you've never actually done it. And I think there is that. I think that's the first thing. The second thing is there's sort of this I think when we get into, there's also a certain element of we don't know how, so we don't want to ask because then we don't want to be seen to, or we don't know how, so therefore I won't do it. Because asking now that I'm now a grown man is going to make me seem like I'm dumb or something, but it's not. Nobody's born knowing how to use a condom. That's why we do so many condom teachers every day. Nobody, not a single person is born knowing how to use a condom. So it's absolutely fine to, number one, learn, because it's actually about protecting yourself and your partner. Fair enough, if you do try and it significantly affects sexual pleasure, whatever. And by the way, there's lots of different condoms now, and the ones that are on the market are, I have to say they're fantastic. And sometimes they can actually enhance sexual pleasure for not just for your partner, and I'm not just talking about the ribbed ones, but even for the male partner as well. And so again, condoms can be a tool. You don't have to see them as something that is kind of that gets in the way of the sexual experience. And it doesn't matter. You don't have to tell your friends the details whether you use the condom or not. They're not going to know. So you can still boast about, oh, I don't like using condoms, whatever, with the men. I don't know. I don't have a male brain, so I guess my brain doesn't go there. But I'm just like, you can still use a condom with your partner, but it's worth exploring all the different options that there are out there. You can use lubrication as well. I mean, people seem to be more open about using lubrication, but for me, when I talk about lubrication, I talk about condoms. Because guess what is naturally lubricated or is usually comes lubricated? Condoms. So that can also be an avenue to, and it's something actually and there are even special condoms you can use for, premature ejaculation and things, and they're really good. They're really effective. So, again, it's about talking about it. It's about being open to these experiences, no matter how old you are. And yes, you can teach some old dogs new tricks. Yeah, and it's just about being honest and being aware. And I think some of it as well, it does come from the ignorance about actually how useful condoms are, what you're using them for, and why. And because we haven't in the past, doesn't mean we shouldn't.
I love how you started it off just to saying we need to ask Black men because it's another thing that just emphasizes how important it is for, first of all, for our lived experiences to be shared and out there and to be amplified more rather than just assuming, but also making sure that we engage Black men as well into these opportunities for research and sharing their thoughts and experiences, as well as Black women. So thank you so much. And I'm sure that the premature ejaculation and the condoms for that as well. I think some people will be surprised to hear about that, because I don't think enough people know about, the variety of condoms and how it can help different people in different situations. So please seek it out. And these are there were some questions about the practicalities of engaging with sexual health services. And one of them is about age. So someone's asked, should mature ladies still get tested for sexual health issues if they feel they aren't sexually active?
Well, I think I mentioned that, you know, when is a good time to get tested. So change of partners, I said before, if you are having regular sexual partners or multiple sexual partners, then every 3 to 6 months. So if you've never had a sexual health screen, it's worth having one, at least once in your lifetime. If you've ever had sex once, it's worth having a sexual health screen, I think. You might, I mean, some people might think that's overkill, but it is worth. This is another thing, and I think I spoke about this, but this was like, I think was it last year, Sakina? Yeah, I think it was before child. About the rising levels of sexually transmitted infections being diagnosed in the older population. This is men and women. And the reason for this is multifactorial, and I'm sure Dr. Appiah can talk more about this. But essentially it is earlier this year. Okay. Time's going quicker. It is also to do with partner change, which is why that's one of the risks. And I say if you have partner change, do a sexual health screening before and after. And also less use of condoms, because condoms, the other benefit of condoms is they're also birth control. But once a woman's over a certain age, you know, you sort of go, oh well, can't get pregnant, don't need condoms, which is fine. But just be aware that that increases the risk of sexually transmitted infections. Also, the post-menopausal changes to do with female genitals as well. But yeah, like I said, what's the oldest person I've diagnosed with an STI? Probably 70 something. So it does happen. It's worth just having a screen. Basically, if you're having sex, just check. It's just part of having safer sex, just having your sexual health screen. So if you are having sex and you do fit into those categories that I mentioned, you have had to change a sexual partner, or you're having multiple partners, then do just get your sexual health screen done. It is worth knowing. Again, it's part of the, you know, knowing is better. And rather than guessing and assuming, well, I've not had anything, so I have not had any symptoms, so I can't. Well, a lot of them don't have symptoms, so don't have to freak out about it. And yes, if you go to sexual health clinics, okay, yes, you'll see a few young people, but you'll be surprised. You will be surprised. And it's fine. Don't judge people, because guess what? The people who are going to get a sexual health screen, they are basically engaging in safer sex practices just by doing that, because they're looking after their sexual health. So again, let's not judge who you find in the waiting room, because guess what? You're being as good as they are, because, you know, you're taking care of your health.
Completely. And you know, I always say, just again, it's such a simplified analogy, but it is true. With cars, we're so vigilant about going for MOTs and making sure that we do everything else. And it is, just see it as part of your health MOT. Just see it as part of, and actually revise that, build in a health MOT into your life. So once a year, even just taking the time to think back, because, you know, like you've just said, was it earlier this year or last year? You know, life goes so quickly that we forget, you know, that a year has gone by. And so you may think it is just only a couple of weeks ago, so that you spoke to someone, but actually it was over a year. So just take a step back and take stock of what's happened in life and think, right, do I need to go and get tested? Is there anything else I need to do? So important. So thank you for that. And I think this other question is a really good question, because it's something that basic knowledge and just people are never aware. So someone's asked, how can someone get tested for all sexually transmitted infections? And so I think just clarifying what can and can't be done and why would be fantastic. And then the second part of the question, which I love, which is slightly political at the moment in the UK, but are there walk-in clinics?
Okay, first I'll do the first part because that's easy. So and this is something I tell my GP colleagues as well. So it is not a full sexual health screen unless somebody has had an appropriate test for gonorrhea and chlamydia, and in women, that is a swab in the genital tract of some sort, not a urine. Still irks me when I see a urine chlamydia gonorrhea test for a female, and I'm like, why? But anyway, not a urine because you don't have sex in your pee tube, or you might do, but not that often. I would hope. And so, yeah, so you need to test where the sex is happening. So genital swab for the woman, and that can be self-taken, so nobody has to examine you if you don't want to be examined, if you don't have symptoms. That's the only caveat, yeah? If you don't have symptoms. So self-taken genital swab, vagina, whatever. And then a blood test for at least a minimum of HIV and syphilis. Those are the two main blood tests, okay? And that is, for me, a complete sexual health screen for everybody. That's the minimum for everybody. And then in certain contexts, and depending on your risk and your vaccination history, you might also be tested for hepatitis B and hepatitis C, but only if you are at risk. So not everybody gets those ones. So a complete sexual health screen is swab or urine for men, gonorrhea, chlamydia, blood test, HIV, syphilis. And then that's kind of your complete screen. So if you can do that once a year or at the end of change in sexual partner, then you've had your complete sexual health screen. The second part of the question, what was the second part again? Walking
Are
clinic.
there walking clinics? Yeah.
So some places do still have walking clinics. Yeah. So I think they get, oh, well, okay, I'm trying not to talk about the funding. I'm trying not to talk about the funding that's up here. So I'm not talking about the funding. Some places do still have walk-in clinics. You would have to check. You can actually check for your local sexual health clinic on the British Association of Sexual Health and HIV website. That has been updated now. So you can go on there. That's bash.org. Am I right? Yeah. And check for, just put in your postcode. It doesn't even have to be your local one. Did you know you can go to any you can access any sexual health clinic in the country? So you can be visiting whoever in wherever and go to that sexual health clinic if you want to sort of be more less visible, or you think that there's a risk you might see somebody you know. That's another way. Because I know not everybody's going to be comfortable. So there are things you can do to mitigate that, but still get your health looked at. So yeah, so you can visit any sexual health clinic in the country. It's not tied to your GP records, and no, it never is. And hopefully maybe never will be automatically anyway, unless you want those things released specifically. So it's something you can do independent of that, but I would say to do it, kind of think about it in the context of your wider health, like we've already said. And so yeah, some places do have walk-in clinics, so you can have a look when those sessions could be to see if you can fit into the walk-in service. Most places that do still have a walk-in service, it often can get busy. So it's also worth, even when you call them, just maybe giving them a ring and just saying, oh, when are your busy periods? If you want to avoid busy periods or when you might be less likely to be seen. Most walk-in sessions, it's always good to get there at the beginning, not in the middle or the end, because like walk-in services everywhere, it will, once it's reached capacity, they will not be accepting anymore. So just to avoid disappointment. But most people find it easier to book an appointment. I hope that helps. Does that answer the question? Did I answer the question?
You did, definitely, and I think you did very well to not get so
to not get stuck in the. Oh, I didn't.
it is really difficult, and you I think it's like, and it's reminiscent of a lot of healthcare at the moment, and so and this is why these kind of conversations are so important, so we can share what is and isn't available, and for people to get added layers of knowledge as well. I've got one more question, but I just want to make sure there isn't anyone on the call that wants to ask a question directly. Please feel free, don't feel shy at all. But it's thank you so much for engaging in the way that you have already, which has been fantastic. But if there's someone on the call that wants to ask a question directly, please feel free. But the last question has been asked about sexual dysfunction. And the person has asked, where is the best place to get help for this? And is there help for this?
Yes, there is.
Broad question, yeah.
Yeah, there is. So the answer is yes, there is. Like a lot of things, there is. And my feeling is that it's underused. And the reason I bring it up is because it is related to the funding, I'm sorry, I can't avoid the funding thing now. If things are underused, they will get defunded. That's one thing I've noticed about just generally our health services in the UK. And you know, a lot of the help that is out there was basically put in place because there's a lot of research gone into the fact that there is a lot of people being affected by this. So we need to make use of these services. That's why I'm saying, actually, not just for your own benefit, but please for the benefit of everybody else. If there is an issue, go and get help. Use the services that already exist. Again, I know. You're going to say, I can't see a GP. You don't need to see one. You just need to tell them you've got an issue, tell them what the issue is. They have a quick chat with you, and then they can refer you to the appropriate services in your area. Some of those services now are actually kind of being joined up together. So also they can be provided remotely. So they may be services for your area, but may not physically be in your area. Oops, sorry. The baby's whinging about my voice. So yeah, but do access it. And yes, nowadays as well, you can just put in things like an e-consult, an electronic consult to your GP. So if it's an awkward conversation, you do not have to have that awkward conversation. You can put it in an e-consult and put in what your expectations are. One of the beautiful things about e-consults is they actually have an area for you to put your ideas, your concerns, and expectations. So you can literally say, put all your symptoms, obviously, so that they have something to put in the referral. Don't just be vague and say, I want to talk about personal stuff, because all that does means that you need another appointment. Okay, so you need to be brave enough to put it into words, even if it's on a computer. Okay, and so do that, put in an e-consult, and usually that should be enough. You know, the worst thing that might happen is that you might get a phone call just confirming, okay, we got your e-consult or whatever, and this is what we can or cannot do. And again, depending on that person's individual history, because obviously your GP will have your or your other diagnoses, hopefully they'd be able to say, okay, actually, this is what we need to look at. We need to look at your health. We need to look at this, because obviously, you know, like I said, the number one reason being lifestyle factors and related to other illnesses. You know, it's the most common reason in GP land that I see people with sexual dysfunction, male sexual dysfunction anyway, particularly erectile dysfunction, is I'll literally just scroll down, check their BMI, and their BMI is over 40, you know, they smoke whatever a day, and they haven't had a health screen, and they probably have family history of cardiovascular disease, and the last time they had a health screen 5 years ago, they were diabetic or borderline and didn't come back for any further screens. So surprise, surprise. And so yeah, so your GP is best placed because obviously your history, but you do need to engage with the other things, because obviously if you do have diabetes, cardiovascular disease, or other things, addressing those also can improve the sexual function without the need for the external services.
Thank you. That's a great response, and I'm really mindful of time, but as ever, as we're going through and people are feeling safer, they're asking more questions. So I've got one more question that I would really like to bring forward to you. So is there any recovery for a female recovered from FGM, so female genital mutilation, to have a sexual life again? And I think this is a really powerful question, reflection. So any thoughts, reflections would be great. Thank you so much.
I would say yes. I'm always optimistic, and actually yes, because I have known ones who have recovered, sometimes with help, with a lot of help, some with a lot of help and some with no help at all. But I do know quite a number of females who have had female genital mutilation who have very fulfilling sex lives. It usually requires a few disciplines, not so much a medical input, I would say, as more of the psychological support services, obviously, and it makes a difference. The sexual partner, it does make a massive difference. And I think the understanding of the sexual partner about the past lived experiences and how that might impact. And I think But I don't think anybody who has undergone that should count themselves out of having a fulfilling sexual life. And I think, yeah, and just like anything in life, it's about finding the right partner that you want to share that with and you want to go on that journey with. And just because you go on that journey with that partner, it doesn't have to be the one that you're with forever. It's just a journey. You know, some people come into your life and they're just part of that journey for that time. Yeah, but yes is the answer. Yes, 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 yes. But do you ask? Do you seek? Do you get the help that you need? And do you take it slow, I'd say.
Thank you. A powerful question and a powerful ending in terms of your answer. I think the concept through all of this as well is being open to share what you're going through so that you can get the right help that you need, and that transcends everything that we've spoken about. Dr. Lebari, thank you so much. What a wonderful session, and you set everything so beautifully, and it's really reflective of all the questions that have come through. And as ever, thank you to everyone that stayed to listen, to engage, and to learn. And please, from conversations like this, please share it with your families, friends, your wider network, because that's why we're here. So thank you so much. And I'm going to hand over to Natasha, who's going to give us an update of events and things to get involved in through the week, and has started to share them in the chat as well. So thank you so much. And Dornu, thank you so much again. Really appreciate it. Over to you, Natasha.
Well, that was lovely. It was great. The amount of private messages that you have received, Dr. Vanessa, is incredible. It really shows that we need to continue to give a platform for all topics regarding health, and sexual health is definitely one of them. So we need to repeat this session more and more times. Thank you, everyone, for their openness, sharing their experiences. It's just really, really empowering to see. I've come to speak a little bit about, before that, thank you, Dr. Vanessa, and thank you, Dr. Dornu, that made the time to share your knowledge with us voluntarily, just to really, raise up the community. Thank you. I wanted to share with you all, now comes the sharing screen part. I hope it goes well. Many of the things that we're doing in CAHN. Okay, full screen, wonderful. So amazing session next week. I'm sure you all agree. We'll be talking about sickle cell and the eye. We have Dr. Evelyn Mensah, that is a massive health hero and advocate, and very passionate about this cause. So I'm really looking forward for the session, and I hope you are too. Join us again, safe space to make questions, to learn, to be in community. No questions are off topic, really. And we have Healthy Hearts every Tuesday. This is our session that is focused on nutrition. And it really comes to complement Health Hour, because nutrition is one of the big natural medicines to really improve your health. So come and join us next week. You can make as many questions as you want to our nutritionist, as it's ask questions to the nutritionist topic. So yeah, just full hour of questions, and it starts at 6:30 and it finishes at 8 p.m. on a Tuesday. Now, if you don't know, you must know, as Black History Month in October, and we have loads of events happening. Our biggest event being the Black History Month Gala. So is all dedicated to celebrating Black excellence. Nominations just ended yesterday. So I would expect many of you have put nominations in, and we're just trying to highlight the work in the community at all levels, literally from voluntary sector to private to young organizations. So come and celebrate with us. We all know it's a great time. So join us on the 12th at 6, and to get your tickets, link is in the bio as well as QR. And we have a very, very special project that started this year, and it's been ongoing now for, I would say, for half a year at least. is the CAHN Wellbeing Hub that is really dedicated to maternal health, perinatal health, to families, and we are there together. First and third Saturday of every month. We are there with all sorts of support. Even if it's just to be in community, share your issues, we'll try to help you, or just to also share your joyfulness. I know they are watching us now in the hub, so big props to them. If you want to register, there is a QR on the screen. And this week, this very week here in Manchester, we're having the launch event of Black History Month. So come with us, kick off the event. There'll be leaders from all across the 10 boroughs of Greater Manchester. There'll be poetry, music, health stalls, business stalls, and it's always very much focused on Black culture and our stories and our contributions. So come and join us. QR is obviously on the screen, but you can also just rock up at the Manchester Cathedral at 6:30 this Thursday. I will be there and I hope to see you there. A big part of Black History Month is to know what's happening so we can celebrate it throughout. So if you have events happening in your community or you're doing an event yourself, we're very much invited to add it to our directory. We already have a number of events in our website that are happening in Manchester because we want everybody to know what's happening in Manchester during Black History Month. So come and input the details of your event on the QR or the link that is also there and on the chat. Now for my London folks, that is a great event that is happening. This in Greenwich University is a collaboration of the London Inspire program, which CAHN delivers, and will happen Tuesday, 8th of October, so just a few weeks left. And it's really a small, intimate kind of event, really, because we want to take people on the tour of the facilities of the university, very much focus on Black health, Black well-being, and come and be together, be with leaders that are your peers, and to register, again, QR and link. Last but not least, we have our ongoing project with CAHN. It's all about awareness, about energy consumption, CO2, safetiness, and just really how to identify certain things that will keep you and your loved ones safe. We have other things that we provide, such as we check eligibility for priority services. We can get you loads of tips, really. I know there is also some sort of free household items that we provide that people that need it the most, such as cookers, slow cookers, blankets, things like that. So to access, again, all on the screen. I just want to thank you so much for being here today in a very, very interesting session, and I hope to see you next Saturday. Bye-bye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk cathip.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.